Hey there. My name's Christine, and you're probably wondering why it looks like I'm in a casino. Well, I'm here to prove a point. After spending over 25 years fighting the healthcare system for my clients, I can tell you without a doubt that unless you know what you're doing, every dollar you spend on healthcare is a gamble. Insurance is basically worthless unless you need a major procedure. Hospitals overcharge insurance, and insurance pays, if they pay the claim, almost double the cash discount. And the cash discount's something they won't tell you about. And nobody tells you that there are other places to get services like labs and radiology for pennies on the dollar. I'll show you what I mean. I just got this in the mail today. It's an EOB for a family member that's on Medicare, and I always investigate these. On this particular one, the total charges for 3 lab tests was $642.50. The total amount approved by Medicare was $44.22. So I went to the hospital's charge master and pulled it down. If I had went there and had these same 3 tests done, I would have paid $305.64 in cash, $250 more than Medicare. If I had filed my insurance, the insurance would have paid or approved $536. So if I'd not met my deductible, I'd be paying $536 for these tests. But there's an alternate lab just a few miles away. If I went there, my total out of pocket would be $127. It's ridiculous. I just had a client last week had a CAT scan in Valdosta, Georgia. MRI. The charge for that MRI was $8,740. Had they known ahead of time, they could have went 20 miles down the road and gotten it for $700. I had another client out in Las Vegas that needed a simple lab test, one simple lab test. I looked it up online. The hospital was going to charge $1,918. I sent him 3 miles away. He got that same lab test for $49. It happens all the time. All the time. And it's ridiculous. Let's break this down again. Hospital charges are $642.50. Medicare pays $44.22. That's the total that the government has decided is fair reimbursement for those 3 lab tests. If I had asked for a cash payment, I could have got those tests for $305.64. If I used my insurance, the insurance payment or allowed would be $536. So if I'd not met my deductible, I would pay $536. Going to an alternative lab right down the road, the total cost for those same tests is $127. That's a savings of $409 over what my insurance quote discount unquote would be. There is no such thing as a PPO discount. They're all smoke and mirrors. Knowing where to find services before you need them is imperative to keeping your costs down. Like and subscribe now. Thanks.